Joining us now from Pittsburgh to discuss more is Dr. Amesh Adalja, a senior scholar at Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. Good morning to you. So 10 months now after the coronavirus was declared a pandemic, we have 2 authorized vaccines. You were just vaccinated a day ago. First off, how you feeling? And give us a sense of where we are.
I'm feeling fine. I actually have no symptoms. I've checked in on the CDC app to report my symptoms, and I've had no symptoms, and it's been about 24 hours since my first dose, so everything is looking good. You know, I think we're in a remarkable place. We've got this great news with 2 vaccines that have now reached emergency use authorization, but I'm on my way to the hospital right after this interview, and I know there's going to be a lot of COVID patients there, and there's really no end in sight. And we're in this place where the virus has accelerated its transmission. People's pandemic fatigue is at an all-time high, and we worry about hospital capacity on a day-to-day basis and wonder how we're going to get through Christmas without having to change standards of care if that pace of cases doesn't slow.
We'll talk about holidays here in a second, Doctor. But first of all here, the HHS said on this week that the plan was to give every American a chance to get vaccinated by June. That's just a little over 6 months away now. Is that realistic?
I do think it's realistic. Everything would have to go perfectly, but it's in the realm of possibility. We'll likely have 2 vaccines that will be online, and people will be able to get one or the other depending upon where they live. And we're moving through the different phases of priority groups. It's going to be harder when we're going into the community-dwelling individuals that are at high risk and the average risk people, because we have to make sure that we can actually get this vaccine into the arms of Americans, and we have to make sure that Americans want to take this vaccine. So this is going to be something that's going to be really challenging, probably one of the biggest public health efforts, if not the biggest public health effort that we've ever done. But it's the only way that we're going to put an end to this pandemic.
Doctor, as you know, polling shows that some people are still really reluctant to get this vaccine. How do public health officials bridge that gap?
We have to be proactive. We have to really model the behavior by ourselves getting vaccinated and talking about it and talking about what side effects we have, if any. We also have to be really transparent about the data, the clinical trials, what we know, what we don't know. If there are side effects that occur, like those allergic reactions that happened in Alaska and in the United Kingdom, we have to talk about those and put that information out there, and we have to set the tone. We can't be responding to anti-vaccine conspiracy theories. We can't be responding to arbitrary assertions. We really have to show the value of vaccines and how life-saving they are and what a triumph this was for science.
AAA estimates that some 84 million people will hit the roads for this holiday. That's about 30% less than normal. Still a lot of people. I know you have problems with that. What worries you most?
What worries me most is when people think that they're in a situation where the virus isn't there and they let their guard down. We saw that at Thanksgiving. We see that with private gatherings all the time. When people are around their friends and family, they don't social distance. They think that they're not going to be exposed to the virus. And that's where we're seeing a significant amount of transmission occurring. And when you have a holiday like Christmas, many more people from different parts of the country where there's different prevalences and different transmission dynamics are all going to be mixing together. And this is going to happen at a time when hospitals already have a record number of people in them. So this is kind of, as Dr. Fauci has said, a surge upon a surge now, basically, because of Thanksgiving and Christmas. So we don't really see, any kind of respite for us in the hospitals, and I think that's the biggest concern, is that hospital capacity gets compromised.
The takeaway here, clearly, do not let your guard down. Dr. Amesh Adalja, thank you so much.